There are four major types of interventions for pain. Passive, where the individual needs to be present but does not have to actively participate. This can be surgery, massage, or medication use. Active, where the individual has to use energy with their body or mind, such as performing exercises or conversing with a counselor. Self-directed, where the individual independently performs a task without the supervision of another person. This could be passive, such as applying and using an electrotherapy device, or active, such as completing a home exercise program or exploring relaxation techniques. And functional restoration, where the approach is improving the entire person to increase engagement in meaningful activities of life. This approach utilizes interdisciplinary care, where different kinds of providers are at the same facility, or multidisciplinary care, where different providers are at different locations. Overall, passive therapy works the least, and functional restoration works the best. Hopefully, by now, you have found a trustworthy doctor or group of providers that have helped you with your pain. Sadly, this is not the case for many. Pain relief is the number one reason for medical visits, with 2/3 of patients reporting chronic pain for over 5 years. A quarter of all chronic pain individuals have changed doctors at least 3 times because their pain continued. Other reasons for changing doctors included treatment wasn't aggressive enough, not being taken seriously, and the doctors lacked knowledge for effective pain treatment. To some extent, it's not the doctor's fault. In 2011, the Institute of Medicine surveyed 133 medical schools to find out if they required courses for pain management. Take a guess on how many had this requirement. 5. That's 0.03%. Ridiculous, right? It's no wonder why I hear so many people say that they don't know what to do. That's including the general population and the medical professionals. If you are like most of us, when you go to the doctor or any other medical provider, you are asked questions that you are not quite sure of the answer. You give your best guess, but later you are able to give a more accurate response. By the next time you see your doctor, you've forgotten about the question and it is not brought up again. Or, how often have you left the doctor's office and suddenly remembered something you wanted to ask or say about your condition? You don't think it's significant enough, so you decide to wait until your next visit, where you will likely forget to bring it up again. In general, it is important to keep a health journal, but it is even more important when you have long-term ailments. Keeping a journal will allow you to keep track of the highs and lows in your pain journey. How you create your journal is up to you. You can customize one of your own, or there are a variety of resources available online. Even though you fill out standard intake information at every doctor's office, it is especially helpful for you and your provider if you have a concise sheet that outlines basic information. This includes current medications, significant past injuries or illnesses, vaccinations and immunizations, surgeries, and current additional medical providers. You should also keep track of past medications and treatments and how they did or didn't help you. When you go to your doctor's appointment, you should bring a notebook with you that includes any questions or comments that you would like to bring up. Sometimes it can be awkward to bring up sensitive topics. Remember that this is your time, and the only way to get better is to let your provider know what's going on. If you write something down, not only does it give you a reminder, it can be more comfortable if you read it off the paper or even hand it to the provider to read. One clinic I was at, the clients were with me 8 hours a day for an average of 4 weeks. Every day they filled out basic paperwork and turned it in. The last section was for additional comments, and every now and then I would get something important that they did not bring directly to me after seeing me for weeks. I would privately bring up the issue with the client the next day, and they would tell me they were embarrassed but happy that I could help them. One amputee had told me the first day he had no problems getting dressed every day, but 2 weeks later he admitted he needed help. Another was a 20-year-old with a back injury who was having marital issues because it was too painful to have sex with his spouse. I have also had clients that waited until their very last day of therapy to bring up their problem. Unfortunately, I had to refer out because they waited too long. It is very important to be honest with your provider and know that we have heard it all. We take your health seriously, and sometimes what seems insignificant can be important. While we don't need to know every single minor bodily change, if something doesn't self-resolve after a few weeks, let us know. Sometimes it's helpful just to know that what you feel is normal. I have people tell me all the time after starting therapy that they are sore after a few days. I usually tell them, "Good, you should be a little sore, or we didn't work you hard enough." Even a completely healthy individual should be a little sore after starting a new workout. Having a notebook will also give you a way to jot down any questions that your doctor asked you and you do not have an answer for, any additional information that you want to research on your own, or remind you later what was discussed, especially if you have a loved one who always asks, "Well, what did the doctor say?" Many times people keep hoping that there is just one magic fix to make their pain go away forever. The truth is, there's not one person or technique that will work on its own. More importantly, the people you work with are only an expert on their own method, and you are the expert on your pain. Many times, multiple interventions are needed to help solve your problems. When I get someone after surgery, let's say shoulder surgery, we can't address the ability to immediately put their dishes away in a cabinet. We first have to address range of motion, then strength, then endurance, etc. You might also have multiple limitations or causes of pain that have to be worked through one at a time to reach your end goal. I hope you have started to realize that pain cannot be viewed as just a physical issue, but a mental one as well. If chronic pain individuals could have all of their issues resolved just by going to one medical doctor, then they wouldn't have chronic pain. The best approach and most successful comes from a multidisciplinary group of providers, where you are an active member of the team. Shocking for most individuals, medical professionals want to know what motivates you, what tools you find useful, and know that you are putting in more effort into your program than they are. Together, the team can set realistic goals and make modifications to your plan of care as needed. Chronic pain participants that use a multidisciplinary approach report adopting a new lifestyle to aid in pain management and health. They are more accepting of pain, able to set boundaries, feel more in control, have an increased participation in life, and adjust medication use. The ability to maintain improvements was influenced by the individuals having building blocks or taking practices learned and incorporating them into daily life, support, such as mental or physical resources, energy, including motivation to participate in activities, and making incremental improvements in various areas over time. There are a large number of professionals that might be part of a multidisciplinary team for chronic pain. Here are just a few professionals you may have on your team: primary doctor, surgeon, occupational therapist, physical therapist, nurse, neurologist, social worker, counselor, psychologist, caseworker, clinical pharmacist, dietitian, and massage therapist. And of course, don't forget professionals at knowing you best, your friends and family. In your medical notebook or journal, you should have a section for each provider. You may also want to make a list of types of providers that you have used or are interested in adding to your team. If there's something you're interested in trying, such as counseling, discuss it with your primary doctor and get a referral if needed. If your doctor is unfamiliar with how another provider can help you, see if the potential provider can have a discussion with the doctor on your behalf. Even occupational therapists still run into this issue from time to time, but we have no problem educating other professionals and advocating for you. A common barrier to progressing with treatment is struggling with attachment issues. Bonding styles are often rooted in how we progressed from infancy. Experiences can be neglect, abuse, etc., affecting our attachment issues with professionals. Many view doctors as the ones who always know best. Your treatment with any professional should be collaborative. Power struggles happen in the medical field, but just know when you should move on to someone who is more aligned with your treatment goals. Even though you may have a variety of professionals giving you information, you are ultimately the one to decide what will and will not be done. If you have a bad surgery or respond poorly to a medication, it's your body, not theirs, that has to deal with the outcome. Do not feel pressure to do something that your gut tells you not to do. If you have an issue with a provider, please bring it up to them. They may not realize that they have crossed you the wrong way, and you may mutually decide it's best to find another provider more willing to work with your needs. It is very important early on to develop a pain plan that is evaluated and modified as needed. All providers involved in your treatment should be on board with your pain plan. Clear goals make it easier to evaluate your progress and proceed in the most effective way possible. Collaboration among a variety of practitioners can be challenging. Be sure you understand clearly what each one is telling you so that you can relay the information when needed. Oftentimes, providers have worked with one another and have developed a good relationship. Referrals from your current practitioner can help expedite coordination of care, but I still recommend doing your own research on the referral. There are several I personally keep up with, and I am able to call at any time with a question on a mutual client. It does make it easier to work with someone who already understands my role and background versus starting a new professional relationship. True or false? If you don't follow provider recommendations, you are a bad patient. False. It's a total myth, but something people believe. Yes, you should give any new treatment a chance to work. Don't give up the first week or two, but also don't keep trying something that's not working without speaking up. Some individuals keep on with ineffective treatment because they want to prove that they are trying hard or believe that it's the only way to fix their problem. What works for some will not work for others, and that's okay. Now you know the different types of interventions for pain, how multiple providers might be needed to help you, that it can take time to find the best treatment plan, the importance of keeping a medical journal, and that you should feel comfortable speaking to medical professionals about your needs. Remember that we are here to help you, but you have to let us know what works and what doesn't.